everyone, my name is Catherine Gorley, and I'd like to thank you for tuning in today for another episode of the Injury Prevention Academy, a podcast brought to you by Dorn Companies, the country's leading wellness-based pain management and injury prevention company. Dorn is committed to reducing costs of healthcare and workers' compensation, as well as reducing lost productivity, which has resulted in over $120 million in savings over the last 20 years for our clients. Joining us today is Anthony Linan. As the current HR Director of Compliance and Employee Safety for Christian Living Communities and Cappella Living Solutions, Anthony has over 20 years of experience in healthcare and human resources, specifically senior living services and skilled nursing care. He's also been recognized by the Governor of Colorado and the Colorado Department of Labor for his efforts and successes in this field to reduce work comp costs. Welcome to the Injury Prevention Academy, Anthony.
Thank you for having me. Appreciate it.
Absolutely, and obviously with working within this field, it's so important, especially over the last couple of years. I mean, it's always been important with the aging population of the United States, but managing a senior living facility during this past year has, I'm sure, been extremely difficult with those changing variables of day-to-day life. And I'm sure that creating a complete safety plan for your employees, but also for your residents, was absolutely paramount. So what were some of the core components of that safety plan?
Thank you. Yeah, so as we know, the senior living industry forever changed in March of 2020 and has required nonstop adapting to the various local, state, and federal guidelines and recommendations for safety and health of our residents and our team members. In addition to constantly adapting our safety and health programs, we know we face continual changes to various state and federal laws that provided financial assistance to our team members impacted by COVID. And while many senior living communities found themselves being reactive to the pandemic, we were very fortunate that our safety programs were a bit ahead of the curve. In senior living, as you know, we face annual flu and norovirus threats. And so our clinical teams had, for years, had ready to activate airborne virus prevention protocols. And so in early 2020, we knew we were facing a possible airborne virus. And so our clinical teams just implemented that protocol, which both direct caregivers and team members were already very familiar with. They were trained on it, which included effective utilization of personal protective equipment, infection control procedures, and resident and patient isolation as needed. Having that virus mitigation safety program ready to go played a huge factor in our minimal resident and team member COVID exposures throughout our communities in 2020 and in early 2021.
Right, and having that open line of communication between your staff, you know, possibly even your residents, to make sure that they're fully prepared for what could possibly happen. I'm sure that people within the senior living communities really pay attention to some of those different kind of news outlets, but the different guidance from, say, the CDC and the WHO organizations.
Definitely. We're always, in line with them and, taking their guidance.
Right. So how does that plan, like you said, that vaccine, or sorry, the preparedness for some of those issues, how does that plan carry forward for, say, possible future emergencies?
Yeah, so the virus mitigation program obviously evolved into a full-fledged COVID plan. So, it adapted. We adapted to it, and our clinical team had in place probably in mid-July 2020 all those same protocols that OSHA just recently established in their emergency temporary standard last month. So once again, we were very fortunate with our clinical experts to kind of have that momentum to get that done sooner rather than later, like OSHA finally came out with. The use of N95 masks in healthcare, that was something brand new to us. So that precaution played a huge role in reducing exposure. Other effective precautions such as contact tracing, notification, and mandated paid quarantine for exposed team members really helped reduce that exposure as well. And then by the beginning of August 2020, we experienced minimal resident COVID cases in our communities, which is greatly attributed to our safety programs in place. Compared to other senior living communities, we did very well with our exposures. Exposure control plans have become the norm for our industry now. We weren't anticipating this, and
Right.
adapting them on the fly with the latest outbreaks, the variants that we're seeing now, is something that our clinical experts and our safety teams are definitely on top of.
Yeah, right. And what are, because you talk so much about the senior living facilities of just having that preparedness. What are some of the universal protocols that maybe other companies and other organizations could utilize from that?
Yeah, just making sure that teams are trained on proper utilization of PPE. Infection control, it's all industries, right? It's not only specific to healthcare. Infection control is everywhere. Other safety program components, they have huge impacts on worker safety. We all say how we know how to wash our hands, but do you really know how to wash your hands? And just making sure that people know infection control and practice it can help save someone from exposure.
Absolutely. Absolutely. I think all of us had the, oh, were we actually washing our hands incorrectly? We weren't aware. So I'm sure, I think everyone has had that learning curve over this past year, and I'm sure just a little more in depth within the senior living communities.
Definitely.
Yeah. And obviously prevention is so key in health and in safety. And you mentioned norovirus earlier, which I'm sure contributed to your preparedness for COVID and possible other viruses that could be seen within these communities. So what can you share with us about that experience, and what were some of the key components that really helped with that preparedness?
Yeah, so norovirus and annual flu season, they're both annual issues we've had to deal with. And I think as we look back and evaluate best practices over the past 18 months with COVID, we may find that continual mask wearing basically eradicated norovirus and flu last season. We had no flu or norovirus in our communities because people were wearing masks. And so I think with 2021 flu and norovirus season coming up, and people moving about in public more as as we open things back up, our communities may see an increase in norovirus and flu. So I think that information is going to come together and provide us with, is mask wearing a thing of the future for our communities? And I think the biggest lesson learned during this whole thing is to stick to your guns with your PPE and infection control protocols, and just make sure that everyone abides by those while they're on the job. We recently introduced a new vaccine mandate policy, as many companies have done, and so, like I said, our safety protocols are continuing to evolve in response to COVID. And although it's a difficult choice, the science tells us that this is the way to go to protect those vulnerable adults that we serve in our communities, and ultimately employee safety too.
Right, and making sure that with everything, it's all about communication, and it's all about keeping the safety of the residents of these senior living facilities, but also the employees. I mean, it's that marriage of safety. I think that really carries forward. Really carries forward.
Definitely.
And now I know that you have worked with Dorn in the past to really reduce those common injuries seen with nursing staff in your senior living facilities. So what were the key benefits to working with those pain management specialists that Dorn provided, and really seeing the results of those benefits?
Yeah, so we have worked with Dorn for many years now, and unfortunately the pandemic interrupted that one-on-one individualized care plan that our employees received with the Dorn therapist. And the number one key benefit was reducing employees' discomfort with MSDs and muscle fatigue and other repetitive injury issues. A lot of people think that only our office and computer workers benefited from Dorn, but we had a lot of Dorn. We had Dorn in our communities, and we had a lot of CNAs that were addressing repetitive lifting, muscle fatigue, and as well
Right.
as environmental services employees that were struggling with repetitive muscle sores. They're pulling laundry out of, wet laundry out of the washers every day, and so
Hmm.
they were having issues as well. And so after all said and done, over the past 3 years, you know, we definitely know through our post-treatment Dorn interviews that a lot of people would have filed a work comp claim. And so I think we've eliminated a potential dozen high-cost MSD claims by partnering with Dorn for that. And
Wow.
obviously, if I had a crystal ball, I could tell you, assign a number to that. But I think, I think the biggest benefit of working with Dorn was that employee morale that we had, because these services were free to them as an employee, and I think it made the employees feel like the organization was looking out for them, and we cared about their overall body fatigue and just their overall health.
Yeah, and really making sure that, like you said, making sure that those injuries truly were not carrying forward. We're really making sure that they are being addressed, that they're reduced. I think is so important, especially for people in your industry.
Definitely.
Yeah, I feel like a lot of times when we talk about safety in that sphere, it's about the safety of the residents, which obviously is extremely important. These are people who really need to be looked after. However, it's also making sure that the nurses and the employees are looked after as well.
Definitely. Yeah.
Yeah, and OSHA actually reports that nursing home workers are actually twice as likely to suffer MSD injuries resulting from those repetitive stress, repetitive movements. And it can be with their hands, their wrists, their shoulders, I mean their feet. So what strategies has been successful to kind of keep those injuries down?
Well, Dorn definitely played a huge role in helping with that, and we also, because we're healthcare, we have the support of physical therapists, occupational therapists that
Hmm.
provide on-site training for lifting and transferring residents. So we have that individualized care planning for our team members to safely transfer and lift residents. But those tasks that require that dexterity, those fine motor skills and repetitive jobs, those are a little bit more difficult to train on. And I know I was working with Dorn when COVID hit to have kind of those individualized plans to help with those types of situations. So we're hoping to get back into that as COVID is hopefully going away in our communities. And we do have extensive e-training as well, library of training modules that provide various roles that also help with
Hmm.
COVID. A lot of one-on-one training went away during COVID just because of the exposure risk there.
Right.
We've also, before COVID, you always say before COVID and after COVID, we've done in-person yoga classes and stretching
Oh, great.
classes, and Dorn therapists have come out and provided stretching exercises, which team members are grateful for. It's amazing what a little stretch in between the workday can help out with. And we also have access to gym equipment at our corporate headquarters, and then there's also gyms in our communities that employees have access to as well to hopefully get some movement going there.
Right, and making sure that your staff has those conditioning exercises so that when they're doing the jobs that they need to do, their bodies really know what to do. It's it using, for lack of a better word, of a repetitive motion, knowing they're going to be doing that and making sure that they're moving correctly within those repetitive movements.
Yeah, and I just want to add, I think that the Dorn therapists were amazing with that.
Mhm.
When we first introduced Dorn to our communities, they just thought it was a massage therapy program, but it's so much more than that, right? And
Yeah.
so I think that after massage therapists came in and they left all of our team members, that they impacted in a better situation than when they first they first came in, because they educated them about, you know, those stretches, and you hear that in training, and, you know, constantly in training, you know, it's important to get up and stretch, walk around, things like that. But I think
Hmm.
hearing it from someone, from a professional like a Dorn therapist, helps ingrain that that health and safety.
Yeah, absolutely. And so many, you know, nursing home, you know, senior living facility workers, they suffer from so many different kinds of injuries. Like I said, like the hands, the wrists. I mean, even back injuries are, you know, tend to be higher because they're performing, you know, specific lists, you know, specific transfers of patients, of even materials, like you said, laundry, you know, of pulling up those large, kind of maybe cumbersome pieces, in order to do what they need to do. So how do you prevent that range of injury?
So ergonomic training has definitely evolved over the years, and I think the CLC Cappella, we have a variety of training opportunities for ergonomics, but
Hmm.
primarily what works best is that, like I said, that one-on-one in-person training tailored to either a specific resident's need or an employee-specific job. And so, you know, we're trying to evolve with that, and it's really hard with COVID. And like I said, you know, I was working with Dorn previously to get in our
Hmm.
communities and look at the ergonomics of the jobs, and then that threw a wrench in it. Floor technology has also, you know, reduced our slips and falls significantly. So, you know, changing up the flooring in our communities has
Hmm.
eliminated. You know, obviously we still have, you know, in Colorado we have that icy weather, so we're still struggling with, you know, slips and falls outside during the winter, but I think
Right.
everyone has that issue, and technology just plays a huge role with those lifts that we have in our communities, those transfer lifts, those stand assist lifts, um, even full body mechanical lifts that remove the employee from that task altogether. Like I said, COVID threw a huge wrench in some other technologies that we've looked at. We've looked at what's called SODER Analytics, which provides caregivers with a device that they could wear all day long, and it measures their physical activity, so that we can conduct
Oh.
a more effective job hazard analysis to
Hmm.
make sure we identify the risks to those employees, and try and do some mitigation there. Mentor training has been limited during COVID, so we're making strides to return to that one-on-one training model again, just so we can make sure we understand how physical the jobs are, so that we can provide that support to our employees.
Right. And I love that you mentioned the different technologies that you're needing to integrate into your employees' lives to do their jobs effectively. You mentioned lifting machines. Has that really helped alleviate some of those back injuries seen?
It really has, and it's funny when you get a first report of injury of a back injury. Um, they'll say they were in a hurry, or, you know, they were too rushed to go get the lift, so, you know, they wanted to do it
Mm-hmm.
quickly, and so they injured themselves. So there is opportunity for improvement there.
Okay. Okay. And then utilizing the different technologies. Um, you mentioned some other technologies that you're using, almost like how, say, office workers get that alert saying, "Hey, you haven't, you know, stood up in 20 minutes. You should probably move around a little bit." Is that something that you've seen has really helped? I'm not sure. Nurses have to be reminded to move around because I'm sure they're constantly on their feet.
Right.
But some kind of utilization of that kind of technology is seen.
Yeah, yeah. We've had a couple of employees come to us with an app that they use, and some people like it. Some people like the apps that, you know, remind you to get up and move. You know, like your Fitbit app. We have provided Fitbits for employees in the past as well.
Hmm.
Some employees love them, and other employees say that they're a nuisance. And so, you know, you just have to find that balance of technology.
Yeah, just depending on what they're doing in any given day, and their familiarization of those different technologies, I'm sure plays a big role in it,
Yeah, yeah, definitely.
right? Now, I always have to focus on mental health, you know, and the mental health support. of employees. It's so important, and I think this past year has really shown a lot of light onto that area. So in addition to obviously the ergonomic support that people have in senior living, how has mental health focus expanded in your arena?
Yeah, so mental health intervention has played a huge role, especially during the pandemic. Every employer has dealt with that, and our VP of HR has had this in mind from early on in the pandemic, and so we made sure that we reached out to our resources. Traditional EAPs. We're very fortunate in our organization. We have on-site chaplains in our communities, and so they played a key role in providing mental health channels for our employees, and just other health professionals that we tapped into throughout the year. Often, in our industry, we find that caregivers are so busy and consumed with taking care of people that they often don't take care of their own personal needs, and they don't take care of themselves. And so we really
Right.
made it a priority, especially during the pandemic, to provide that emotional support, mental and financial as well. We're very fortunate. Our board of directors stepped up and they set aside over $100,000 to help those impacted by COVID, those employees that were impacted by COVID, whether it was
Mhm.
directly at our organization or they had a family member impacted.
Mhm.
We established a critical needs fund so that dollars could be accessed for employees, so that they could focus on coming to work to take care of our residents rather than worrying about financial issues at home, because financial issues can impact mental wellness as well.
Absolutely, because it typically isn't one thing that impacts mental health. It's a combination of things where it builds and it builds and it builds, and then unfortunately sometimes spills over. But having that mental health support within your workplace is so important.
Yes.
Yeah. Do you find that that's something that will continue to evolve for people for employees in senior living and other organizations?
Yeah, I definitely think even in our organization, I think we're more attuned to mental health and than we ever have been in the past. I think that the pandemic kind of put that in perspective, just how things are in the world today, and I think that mental health is definitely going to be a bigger push in the future.
Hmm. That's great. That's great. Now, we talk about some of the forward strides and the different avenues that we're going into as we're kind of heading out of some of these really large pandemic issues, and so much of that is now utilizing those virtual technologies. Some assisted living facilities actually have clients just staying at home and having people go out into the field to really help them. So how do you manage the ergonomic safety of some of those workers that go out in the field?
Yeah, so that is difficult, Catherine. I think that that is our next opportunity for improvement. We're definitely seeing the role of traditional caregivers increase physically as stay-at-home clients have higher and more demanding needs. Typically in the past, we've seen a majority of home care injuries that involve, being bit by a client's dog or scratched by their cat, or
Oh
they
gosh.
or they burn their hand while preparing a meal for clients. But we're starting to see a rise in caregiver back injuries and shoulder strains, and um, you know caregivers are facing clients that have more needs than they ever have before, and so we need to really look at our caregiver model and see how we can support those remote workers as well. So we're working on that for sure, to help reduce those remote worker injuries and exposures. It's going to be a challenge, but something we need to pay attention to.
Right. And is that remote structure something that you see growing over the next couple of years?
Definitely, I'm not an expert in that area, but I think that people are hesitant to put people into senior living communities now with COVID, with all the COVID
Mhm.
exposures. So they might be more willing to keep their loved ones at home and provide that direct care in-house. So I definitely think that home care model will be growing in the future more so than it has in the past.
Okay. Okay. Because I'm sure that, and obviously it's all about that one-on-one care that a caregiver can provide to residents and also to people who are out in the field. So is our virtual solutions starting to be kind of explored at all?
Yeah, definitely. We're looking at virtual solutions. We're looking, everything's on the table when it comes to looking at ways to keep our employees safe. We seriously look at everything.
Okay. I find that just really exciting because there are so many ways forward to protect your residents, but also to really protect your employees in just doing their day-to-day activities.
Yes, definitely. Yeah, that's our priority.
Yeah,
Resident and team member safety.
absolutely. Absolutely. Well, perfect. Thank you, Anthony, so much for joining me today and really exploring some of the ways that we're really moving forward and having that preparedness for what comes next and really learning from these past couple of years.
Sure. Thanks for having me, and I appreciate your time as well.
Yeah, no, thank you. And then thank you all for joining Dorn's Injury Prevention Academy. Tune in next time to learn more about the innovative steps and programs taking place in today's world of safety.